Hi everyone, I'm here today to talk about 3 different potential causes of your back of the heel pain. So this back of the heel area is usually what people will think of as the Achilles area. So this right here, this area, there can be a bunch of different causes of pain besides the Achilles tendon. But we're going to start with the Achilles tendon because that's the thing that people most talk about. I'm going to actually take my sock off here so I can point to a couple structures. Please excuse my lovely runner's feet. And so this tendon right here that you can kind of squeeze in the back, that's your Achilles tendon. That is responsible for absorbing shock when you go through running, jumping, anything like that, when you're hitting the ground, pointing and flexing and stuff like that. And that tends to get irritated over time sometimes with some overuse injuries. If you're not able to kind of absorb force well enough through the rest of your structures, that tendon can get worn out over time with running and jumping activities. Also, it can have there's 3 different types of Achilles tendon injuries. There's a tendonitis where there's some active swelling in that area. There's a tendinopathy or a tendinosis. We're not going to get into the weeds of that right now, a video for another time. But basically, the Achilles tendon will hurt along this area, sometimes up into the calf. So from the bottom of the calf here to about the right where this tendon, this little squishy part ends onto the hard bone of the heel. So from here to here is where you'll feel pain. And that is something that can, like I said, you can have swelling with that. You can have pain with activity. And you can have pain with just pointing and flexing the toes. Another thing that can cause pain in this back heel area, people don't realize this, but there's actually nerves that run along the Achilles here and just under it. So, you'll usually feel that pain on the sides here. Sometimes if the heel pain kind of travels down below the back heel and kind of goes into the side here or here, that can be nerve-based. So if it's along the back and then a little bit into the sides, you'd be thinking a little bit more nerve-based because the tendon ends here and it doesn't actually extend that way at all. So that's another thing that can cause pain. Another thing, so with the nerve, you can have some swelling. It's not as common, but it's possible. Nerves can swell just the same as a tendon or a sprained ankle or anything like that. You would possibly have pain with pointing and flexing, but it's less likely to have pain with just pointing. Sometimes you will, though. Usually this is also something that's more common in runners and people who actively run and jump a lot. And it will pretty much feel similar to a lot of Achilles tendon type symptoms, except the pain might move around a little bit more, and you also might have other associated symptoms with that one. Finally, we want to talk about the posterior impingement, ankle impingement, and that is basically I'm going to grab a skeleton here, so give me 1 second. Basically, you have 2 bones that make up your heel. Here you have the calcaneus and the talus. The talus is right here. The calcaneus is kind of here. So you can see that there's a little bit of space here. There's actually a joint, and sometimes that joint can kind of get a little restricted, and that can hurt. There's also a bunch of tissue around the joint that can kind of get impinged in the joint. So your big toe flexor, your flexor hallucis longus tendon, actually comes along around the back of your heel, along here to your big toe, and that can actually cause a lot of pain with pointing, especially in the end ranges. This is more common in people who are dancers and are going to full point, so fully pointing the toes. More common in soccer players as well, because they're going to be doing a lot more pointing and flexing at full ranges of motion with kicking movements and with kind of dribbling the ball as well. This can happen in runners, but it's a little bit more common in the first 2 things, especially with dancers. So that's something where you want to test and see if, you jump off the ground and you have pain when you get to the full point position. Could be flexor hallucis longus impingement in the posterior area. So it's a posterior impingement but caused by a flexor hallucis longus issue. There's some other tendons that live on the other side of the heel, so this outside heel area that kind of drop along there, and those are your peroneal tendons. Those will also go to different places in the foot, so if you have pain in the ankle but also under your big toe, you could, on the outside of your ankle and under your big toe, instead of flexor hallucis longus, we could also think of peroneal involvement there. So that's also called the fibularis muscle, not to get confusing, but that's another thing that can cause pain. All of these have really different rehabs, so if you are somebody who has tried Achilles tendon rehab and it hasn't worked for you, it's possible that either you're not doing the right Achilles tendon protocol, you could have, a tendinopathy, but you're being treated for a tendonitis or something like that, or it's not your Achilles tendon. That's the thing that people mostly think it is, but depending on where the pain is in the heel and what symptoms you have and how you present, it could be any of those things. And I will be making separate videos on all of those at some point. You can definitely check out my neurological Achilles video, though we have that one already up. So there should be a link up here that I'll have to that, so you can kind of explore that one a little bit more in detail. And please subscribe if this is something that you are kind of dealing with, so you can kind of get a full rundown on all these conditions. And you can also reach out to me. My email should be in the comments or the caption below, and you can ask me all the questions that you have about that. Thank you, and have a good one.